Hello everyone, I am Dr. Yang. For over 2 decades, I have stood in hospital corridors, held the hands of terrified families, and looked into the eyes of patients whose lives were irrevocably changed in the blink of an eye. What I have seen time and again is a common, tragic thread, a lack of knowledge about one of the body's most critical emergencies, the stroke. Today, I am not just speaking to you as a doctor. I am speaking to you as a guardian, a friend, and an advocate for your most precious asset, your health. What I am about to share with you is not just medical information, it is a potential lifesaver. We are going to dive deep into the 9 dangerous signs of a stroke. This is not a light topic, and I will not sugarcoat it. The stakes are too high. But by the end of our time together, you will be armed with knowledge that could save your life or the life of someone you love. Let's be very clear from the outset, a stroke is a brain attack. It is not a distant, abstract concept that happens to other people. It is the sudden, violent disruption of blood flow to a part of your brain, starving it of oxygen and nutrients. Within minutes, brain cells begin to die. The functions controlled by that area of the brain, be it your ability to speak, to move your arm, to see, or even to think, cease to operate. Time is not just money in a stroke, time is brain matter. Every single second of delay results in the loss of approximately 32,000 brain cells. Every hour without treatment ages the brain by 3.6 years. This is the brutal mathematics of a stroke. The most powerful weapon we have against this devastation is immediate recognition and action. That is why understanding these 9 signs is not merely educational, it is a civic, a human, duty. We will go beyond the simple acronyms you may have heard and delve into the specific, often missed nuances of each symptom. Pay close attention. The first dangerous sign, sudden numbness or weakness in the face, arm, or leg. This is often the most classic sign, but people frequently misinterpret it. I am not talking about a limb that falls asleep after you have been sitting in an awkward position. This is different. This is a sudden, profound, and often one-sided weakness or a complete loss of sensation. Imagine trying to smile and only one side of your mouth responds. You attempt to raise both arms, but one arm drifts downward, heavy and uncooperative, as if it no longer belongs to you. You try to walk, and one leg drags, or your foot drops, making you stumble. This happens because the stroke is damaging the motor cortex, the part of your brain that sends commands to your muscles. The key word here is sudden and one-sided. It is not a gradual tingling, it is an electrical switch being flipped off. If you or someone near you experiences this, do not wait to see if it gets better. The brain is sending a mayday signal. The second dangerous sign, sudden confusion or trouble understanding. This sign is particularly insidious because the person experiencing the stroke may not be aware of it. It is a sudden disruption in the brain's ability to process information. A person who was perfectly coherent moments ago may suddenly be unable to understand what you are saying to them. It is as if you have started speaking a foreign language. They may look at you with a blank, confused stare. They might be unable to follow a simple command or a familiar conversation. This occurs when the stroke affects the temporal lobe or other association areas critical for language comprehension. The person is not being difficult, their brain is literally under attack and cannot decode the words coming in. This is a medical emergency, not a moment of forgetfulness. Do not assume they are just tired or distracted. This sudden mental fog is a red flag the size of a house. The third dangerous sign, sudden trouble speaking or slurred speech. Often paired with confusion, this symptom involves the brain's speech production centers, typically Broca's area in the frontal lobe. The person knows what they want to say, but the words come out garbled, slurred, or completely nonsensical. It might sound like they are drunk, even though they have not consumed any alcohol. The muscles of the tongue and face, controlled by the brain, are not receiving the proper signals. You might ask a simple question like, "What is your name?" and the response is a jumble of words, a slow, thick-tongued attempt, or silence where there should be an answer. This is profoundly frightening for the person experiencing it. They are trapped inside a mind that is working but a mouth that will not obey. This is one of the most recognizable signs of a stroke and demands immediate action. The fourth dangerous sign, sudden trouble seeing in one or both eyes. Vision is a complex process handled by the occipital lobe at the back of the brain. A stroke can disrupt this process in dramatic ways. This is not a gradual blurring from needing new glasses. This is sudden. A person may experience a complete blackening of vision in one eye, as if a shade has been pulled down. They may have double vision, seeing two of everything, which is disorienting and nauseating. Another common manifestation is a loss of peripheral vision, where the side fields of sight simply vanish, creating a tunnel vision effect. Sometimes, it can be a sudden blurring or a gray out of sight. The critical factor is the sudden onset. The brain's visual processing center is being starved of oxygen, and it is shutting down. Ignoring this can lead to permanent blindness, on top of the other devastating effects of the stroke. The fifth dangerous sign, sudden dizziness, loss of balance, or lack of coordination. The cerebellum, located at the back of the brain, is our center for balance and coordination. When a stroke strikes here, it creates a sensation of the world spinning violently. This is not a lightheaded feeling from standing up too fast. This is a severe, room-spinning vertigo that is often accompanied by an inability to walk a straight line. A person may stumble, veer to one side, or be completely unable to stand without falling. They may complain that the world is tilting. This loss of coordination can also manifest as a sudden clumsiness. They may fumble a cup of coffee or be unable to button a shirt. This symptom is dangerously often mistaken for being intoxicated or having an inner ear problem. But when it comes on suddenly, especially with any other symptom on this list, you must assume it is a stroke until proven otherwise in a hospital. The sixth dangerous sign, sudden, severe headache with no known cause. I want you to listen to this very carefully. This is not your typical tension headache or even a common migraine. This is a thunderclap. Patients often describe it as the worst headache of my life. It hits with explosive, unbearable force, like a clap of thunder inside your skull. This kind of headache can be a sign of a hemorrhagic stroke, where a blood vessel bursts inside the brain, causing bleeding and immense pressure. The pain is often unlike anything the person has ever experienced before. It may be accompanied by vomiting, neck stiffness, or a sensitivity to light. If someone, especially someone who does not normally get severe headaches, suddenly cries out in agony from head pain, this is a code red emergency. Do not give them aspirin and tell them to lie down. This headache is a scream from the brain itself. The seventh dangerous sign, a feeling of something being very wrong or an impending sense of doom. This is a less clinical but equally vital sign. Many stroke survivors report a profound, inexplicable feeling that something catastrophic was happening to them. It is a visceral, deep-seated sense of impending doom. They cannot explain it logically, but they know, in their core, that they are in grave danger. We should never dismiss this feeling. The human body is a sophisticated organism, and when its central processing unit, the brain, is under attack, it can send out global distress signals that manifest as an overwhelming feeling of dread or a certainty that death is near. If someone tells you they feel like they are dying, believe them. This intuition, combined with any other sign, is a powerful indicator of a neurological catastrophe. The eighth dangerous sign, sudden nausea, vomiting, or hiccups. While these can be symptoms of many minor ailments, their sudden onset, particularly in conjunction with other signs, can point to a stroke. This is especially true for strokes occurring in the brainstem, which controls many of our automatic functions like breathing and heart rate, as well as reflexes like vomiting and hiccuping. When a stroke affects the brainstem, it can trigger sudden, projectile vomiting without any nausea, or persistent, intractable hiccups that will not stop. In isolation, you might think it is a stomach bug. But when paired with dizziness, double vision, or weakness, it completes a very dangerous picture. Do not dismiss vomiting or hiccups as trivial when other neurological signs are present. The ninth dangerous sign, sudden loss of consciousness or seizure. This is the most dramatic and unmistakable sign. The person may suddenly collapse, become unresponsive, or have a seizure. A seizure from a stroke can look like any other seizure: stiffening of the body, jerking movements, and loss of bladder control. This occurs because the sudden damage to the brain creates an uncontrolled electrical storm. It is a clear signal that the brain is in a state of acute crisis. This, of course, prompts an immediate call for emergency services. There is no ambiguity here. Now, you have the list. But knowledge without action is worthless. So, what do? We use a simple, globally recognized acronym to remember the most common actions: F.A.S.T. F is for face, ask the person to smile. Does one side of the face droop? A is for arms, ask the person to raise both arms. Does one arm drift downward? S is for speech, ask the person to repeat a simple phrase. Is their speech slurred or strange? T is for time. If you see any of these signs, even if they go away, it is time to call emergency services immediately. Note the time when the symptoms first appeared. But I urge you, do not stop at F.A.S.T. F.A.S.T. is a brilliant tool, but it does not cover all 9 signs we have just discussed. It does not cover the sudden blinding headache, the sudden blindness, the sudden confusion, or the sudden vertigo. Your action plan must be broader. If you witness any sudden and unexplained neurological symptom, you call for help immediately. Do not call your family doctor first. Do not drive the person to the hospital yourself unless you are hours from any ambulance service. Why? Because emergency medical services can begin life-saving treatment the moment they arrive. They can alert the hospital, so the stroke team is waiting and ready. They know which hospitals are designated stroke centers with the necessary expertise and technology. You driving them yourself wastes precious minutes. When you are in the emergency room, be the advocate. Tell the triage nurse, I think this is a stroke. Mention the time the symptoms started. This information is critical for determining treatment eligibility. Now, let's talk about why this urgency is so absolute. There is a treatment called TPA, a clot-busting drug, that can reverse a stroke if given within a few hours. There is also a procedure called a thrombectomy, where a surgeon physically removes a clot from a brain artery. But these treatments have a strict time window. The clock starts ticking from the moment the first symptom appears. Every minute you wait, the window of opportunity gets smaller, and the chance of permanent disability or death grows larger. I have seen patients who arrived at the hospital 30 minutes after their stroke began walk out a few days later with minimal issues. I have also seen patients who waited 12 hours, convinced it was just a funny turn, who will never walk or speak normally again. The difference between those two outcomes was not just medicine, it was the knowledge and swift action of the people around them. Stroke does not discriminate. It can happen to the young and the old, to the fit and the unhealthy. While risk factors like high blood pressure, diabetes, smoking, and high cholesterol increase the odds, a stroke can strike anyone, anytime. This is why you must share this message. You are now a carrier of life-saving information. You have a responsibility. Talk about this with your family over dinner. Discuss it with your friends. Share this knowledge with your coworkers. Make sure your children, even your teenagers, know the signs of a stroke. They could be the one who saves your life. The greatest tragedy in my profession is not the stroke itself, it is the preventable disability that follows a delayed response. We have the tools. We have the knowledge. The only missing link is you, your awareness, your courage to act, and your willingness to share this message. This is Dr. Yang, signing off. My mission is to empower you with the knowledge to protect your health and the health of those you love. If this speech has been valuable to you, if you believe this information is as critical as I know it to be, then I have a simple request for you. Please, subscribe to this channel. By subscribing, you are not just getting more content, you are joining a community dedicated to health and preparedness. You are ensuring that this life-saving information reaches more people. Like this video to push this message to the top of the algorithms, so it is seen by someone who might need it tomorrow. And most importantly, share this message. Share it on your social media, send it in your family group chats, email it to your friends. You never know whose life you might be saving. It could be your neighbors, your parents, your best friends, or your own. Thank you for your time. Be well, be vigilant, and be a hero. Share this knowledge.